You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, how small improvements to your smile can make a big difference. With us, we have an expert on the topic. He is Pennsylvania's cosmetic dentist, Dr. Granados. Dr. Granados, welcome to the program.
Pleasure to be here.
Now, before we get into today's topic, for people that don't know you, I guess you've been in practice about 35 years.
35 years.
Who's your typical patient and what are the different procedures you do? I guess you do everything there.
Well, we consider ourselves basically a full family dental practice, which means we see people from the children to the grandparents, and we do pretty much the full gamut of dental procedures, from simple whitening procedures, simple cleaning procedures, all the way up to and including the kind of smile makeovers, the major makeovers you see on TV.
Okay, good, good. Now, your wife works in the practice?
She does.
Is that right? You met her when she was a dental hygienist?
We were both students at the same time, and I was in the dental school, she was in the hygiene school, and one of the problems that hygienists had to do is they had to find people to practice cleaning teeth on. And I certainly volunteered, and so that's kind of how we got together. And she reciprocated about 6 months later when I needed some patients to do dental work on. And I think I got the better of that deal, but it worked out pretty well.
Okay, good.
So far.
Now you've been a dentist, I guess, your whole life, right?
Well, almost.
Grandfather was a dentist, sister's a retired dentist, cousin's a dentist, both uncles are dentists.
Yeah, that's
Did you always know you wanted to be a dentist?
I actually, I had a pretty good idea. When I was very young, I would go to my grandfather, and he'd let me in his office. And I can remember being amazed at the neat stuff he had there. There were teeth all over his office, and I remember I really got a kick out of when the people would walk out, they'd have these big smiles on. And I just thought that was great. And I remember when people would ask him what he did for a living, he would kind of shyly smile and say, "I make people smile." And I just thought that was a neat way to make a living. Yeah, I've used that line.
Do you?
Yes,
you
I
say
do.
that? Because nobody likes going to a dentist, right? Do you still hear that?
All the time, yeah.
And how do they say it?
You know what
no
they
offense,
say,
doctor?
You know what they say? They say, "I hate the dentist, but not you." And I go, "Well," and then they say, "Don't take it personally." And I kind of laugh and I say, "Well, I have to take it personally." Then we get into a joke. Once we break that ice, okay, and I appreciate the people saying that, because that means I can very well say, "Look, you don't have to worry about that," and then it just makes things a lot easier.
Okay, now we're talking about smile makeovers today.
Yes.
And we talked on the phone. You say there's a lot to it. How much art, how much science is it?
Well, interesting. That was one of the things I learned at practicing. When I graduated from school, it was a while ago, I would say it was probably 80% science, 20% art. We were told what to do and how to do it.
Okay.
Okay, and as I was practicing, I was learning little things that worked a little better, didn't work as well. Obviously, spending some time with continuing education, I learned a lot more about it, and I started to enjoy the 20% of the art, and it became 30%, 40%. Now it's more 80% art, 20% science. That's where all the fun is.
Now, this Las Vegas Institute did some research.
Yes.
I guess dentists from all over the world
Travel
there to learn what?
Well,
cosmetic dentistry?
Actually, they specialize in cosmetic dentistry. It's probably, if it's not the biggest group, it's one of the biggest groups as far as alumni are concerned. And they have a big facility out in Vegas, and it's first rate, run by great people, some of the sharpest guys in dentistry. And they focus on basically aesthetics, and again, they tend to pay more attention to the higher end things, the full rehab makeovers. And when you deal with those kind of people and you hang around with those kind of people, it really makes it exciting. And when you find out what they're doing, and you realize that you can do the same thing at your office.
Good, good. You know, people need to know this is a real interview. I'm not trying to side with you. You know, we've talked on the phone, about this interview.
I understand.
But do you think it's true that the public thinks that all dentists have the same training, or they're all doing smile makeovers the same way?
Well, technically speaking, all dentists do have the same training up until the day they graduate. Okay.
You've spent what, 1,000 hours on learning?
Easily.
Is that
okay.
right?
Once you get out of school, personally, I think that's when your education really starts. Someone once told me, he said they'll teach you enough in dental school so you don't hurt anybody. Okay, but quite frankly, there's a lot more to dentistry than that. And the fact that the continuing education is there's so many places you can go to, and it's so available that it just makes it much more exciting. You learn new things every day.
Because I always think I could spot veneers walking down the street.
Yes,
They seem big and bulky.
I
You say
understand.
those aren't my patients.
well, I would hope not, but I talk to people sometimes about that, and I'll say, have you ever seen a really good toupee?
No.
Okay. No, well, that's what everybody says. And I said, no. The point is, if it's that good, you've never seen it. You didn't know it was a toupee. So in fact, that's kind of the way I look at my veneers. I mean, anybody can take a piece of porcelain and cement it onto a front tooth and make it look like a big white tooth.
Okay.
And make sure you get it on straight so it's the classy result. But it really takes a lot more to get to blend in the teeth with the lips, you actually have to consider the eyes even. The teeth have to be lined up with the eyes. And so there's a lot to it, a lot of little things. And that's what a place like LVI really brings out that things. It's amazing. Sometimes you don't see it, but once someone tells you about it, you can't miss it.
And it doesn't cost more to go to a guy like you, right? I mean,
No,
a trained artist.
No, it's not. It really it can be sometimes frustrating with that because we do spend my associates and things, we do spend a lot of time learning, and it is a little sad when we see somebody who has one of those kind of big veneers.
Because we see on TV, some of the housewives shows.
Oh, yeah.
Big giant teeth.
Oh yeah.
So you're saying that's not what they wanted? Maybe that was the eye of the dentist?
Either they
Is that your take?
Either they wanted that, and they said, "I want the biggest, brightest, whitest teeth you can make," and nobody talked them out of it, which I think they should have. I think they have an obligation to say, "Look, let's be realistic about
Like you don't
this.
want to let your patients make a mistake.
I would not like them to make a mistake. Okay, I mean, I want them to do what they want to do, but if they're going to be making a mistake and there's a train wreck in the future, I want to say, listen, I want you to understand that this will happen. And sometimes what will happen is if somebody says they want those big teeth, I'll say, well, before you make your decision, come in, sit down. I can take a little bit of a composite resin material and put it on their teeth and say, do you want it bigger than this? And I'll make it very conservative. And they'll say, no, that's fine. And I said, that's it. So we take an impression, some pictures of that, and that's the way we determine. But I don't want someone, I would feel terrible if we design the case real nicely and put it back in, and all the time I'm thinking, it's too big. I'm not going to like it. She's not going to like it. Nobody's going to like it. Unless the person says specifically, I want people to know that I just spent some money on veneers, okay, then I don't want that to happen.
So let's move on then to the categories of cosmetic dentistry.
Yes.
Do they call them smile makeovers? What do you call it?
Well, you can call it a smile makeover, but that's kind of encompasses everything. That encompasses things from a simple, you may have a tooth that's a little too sharp and it drives the person crazy. You just smooth that down. Brightening procedures make a big difference.
Whitening, is that very popular?
It's very popular, and it's actually, I don't understand why everybody doesn't do it. Okay? Because it's a simple thing, relatively inexpensive, and the results are amazing. I mean, I've seen people drop easy 10 years in just looking with just a simple procedure.
Whitening will make you look 10 years younger.
Can, not all the time.
How so? What do you mean by that?
Well, first of all, I think part of it is the actual color of the tooth. Okay, but more than that, when you look in the mirror and you see that bright smile coming back at you, you kind of tend to smile a little bit more. Okay, and so you get a little bit, and so everything kind of gets up, and I would assume that when ladies put makeup on, it just looks a little different, and so it's a happier. Your whole face lights up. It's not just the teeth that brighten; your face brightens. Okay, and that's one of the things I like because it doesn't hurt. It's very simple. It's very, very predictable. And I don't think I've had anyone not be thrilled with it.
Okay. What's the next level up? Like, what are some other cosmetic procedures?
Well, we start with something like that. Then you have, like I said, the little, some people have very sharp canine teeth, which are the teeth here, and they look like fangs, and they say they look like fangs. Well, I look at it and I go, look, that looks fine. But if they say they look like fangs, and I can fix that with a very minor, just grind it down a little bit, which probably they would grind it down in the next 20 years. I can just make it quicker, okay? If that were the case, I just grind it down a little bit. And here's something that shouldn't be a problem, okay? I mean, I don't see it as a particular problem, but the patient did.
Now, one of the big points that your wife says, he's a great listener, that it's not about what he thinks, it's more about what they think. Elaborate on that.
Well, I'll tell you, that's one thing that we didn't learn in dental school, was how to listen. We were told to basically tell people what they need. Okay, well, after practice for a little while, you realize that it's more important what the person wants than what I want. And so basically what I'll ask, one of the things I ask just routinely is, what is it about your smile you like?
So in a consult, they're there with you and you say,
First thing I'll say is, what would you like your teeth to look like? What would you like your smile to look like? What are you looking for in a dentist, in a dental procedure? What do you want? And many times they'll say something I had no idea. Somebody says, well, I hate this corner on this tooth. And I look at it and I go, that corner? It drives me crazy. Every time I put my lipstick on, it hangs down. And if I look at it, and if it's a basically small thing, and I can round that off without affecting the tooth anyway, we're going to do it. Okay? And actually, the person thinks I'm a genius. It's really neat because it's really not that complicated. But I wouldn't have known that unless I said, what is it that's bothering you? And I think that happens a lot where people assume that the dentist is going to say, you need to get that area smoothed off, when in fact, I didn't notice it as a problem, but it's a very real problem for them. And so I want to know what your opinion is of your smile. I can tell you mine.
but you give them options on what you think they can do to pick it up a notch?
Oh, absolutely. You don't need to go to dental school to know what your options are. I'll tell you. Okay?
Okay, good,
And basically, that's something that we want to do. I want to make sure that you know, it's very important you know all your options. I do not want somebody coming back to me and saying, why didn't you tell me I could do a whiten my teeth?
Does anybody ever say this, by the way? Like, why didn't you?
I've heard people. I've had to defend other dentists when they came in. I said, "What would you like to get your teeth whitened?" And the guy, "Well, no, the dentist said it's not good." And I said, "What did he say about it?" And then usually the story gets a little gray. And I said, "Well, sure you can get your teeth whitened." So I would hate to be that dentist when the patient came over and I told him, "You can do it." I don't know why he wouldn't have said, "Yes, let's do the procedure," but he may have had his reasons. I don't know. But again, the person, it's a very minor fix, and it really makes a big difference because you see big changes.
You say you're changing people's lives. We talked on the phone. You really think you're changing people's lives?
Yeah.
With just fixing their teeth?
Absolutely.
You see it?
They
tell
it
you?
all the time. They tell me when I'm not even thinking about it. People will come back in and give me a story about.
Like what?
I haven't spoken to my father in years, and I went in. He said something about my teeth, and we got a conversation. It was really weird. That's a true story. Okay. I have a situation where I had a lady actually not too long ago, and she had a horrible situation. Her teeth were crooked and just really out of line, and we were able to fix them up for her. And next time I saw her, she looked like a different person. Okay, she had redone her makeup. She had gotten her hair done differently. She had gotten a new set of glasses. I mean, it was amazing. I almost didn't recognize her, and it was for a relatively simple thing. Okay, my assistant who was bringing her back into the office went out to get her, and she didn't know it was her.
Really?
Okay, and I kind of said, "Now seriously, you weren't paying attention. You couldn't have not known it was her." And she said, "No, I really didn't. I didn't know." Now I had an advantage. I did have her name on her chart right there in the office. I knew who it was. I knew who to expect, but she looked so much different. I mean, I had a woman come in, and she was a kind of an old 50. Okay. And she had some issues. We did some relatively simple procedures on her, and I'm telling you, the next time she came in, she was a young 50. Okay. And if you understand what I mean by that, it was transformational. And she comes in with stories about going out with her friends, and she's happily married, so that's good. And probably happier married at this point because I think she's lost about 10 years.
How important is a smile? I mean, you're a dentist, and I'm asking, of course, you this question, but I mean, how important is a smile?
Well,
as you see it,
I don't think people really respect how important a smile is the way they should.
Okay.
If you think about it, there used to be a saying that the eyes are the window to the soul. Well, I think I can be comfortable saying that your smile is the front door, because that's the way you let people into your life.
Okay.
Okay, that's the way you engage other people. When you see somebody, that's going to be the first thing you're going to look at in most cases. Because a smile, basically, first of all, if you want to think about it, we have to know, is it a friend or foe? I mean, back when we were running around in the jungles and things, the question might be, you had to know if that person was going to be a friend or not. Okay, so a big smile, it's welcoming. Okay, and that's the biggest thing.
Well, do you think there's a lot of people walking around your town that don't smile because they don't like their teeth, and people think that they're mad or depressed or whatever?
See them every day. I mean, if you
Could
came
you
up to
spot
me,
it?
I think
People that
everybody
don't like
can,
their
I think
smile?
everybody can spot it, because what they do is they don't smile with their lips open. That's the smile. Okay, or when they laugh, they'll do this. Okay, or when they're talking, they'll do that. And it's sad, because a lot of times it's a very simple solution.
Are they afraid of the cost, or are they afraid of the pain, or all of the above? I mean, what is...
Well, they may be, but it's not appropriate, because the cost is not nearly the problem it was. The pain is non-existent, really. I think what the problem is, they don't know what to expect. They might be afraid of the unknown, okay, because they don't know what their options are. What can I do? Can I do something about this? Will my friends think I'm being vain? That's something that always surprised me.
Really?
And I said, boy, no, your friends are going to appreciate it, because they're the ones that have to look at you. You know, so that's something that I think is important. But no, it's a shame to see people that way, and you can see that they kind of shrink back a lot of times. And if you're with a group of people and somebody tells a joke, and these 4 people are laughing really hard, and this other person is kind of snickering with their hand over it, that's a sad. That person didn't enjoy that joke as much as the other people did.
So you fix their smile. They
fix the
smile
smile.
more.
They smile
You
more.
say they're happier.
They're happier.
They
They're
become more attractive.
confident. They don't. See, one of the problems that a lot of people have, and Randy, you have a great smile.
Thanks.
Okay, and you really almost have to have a problem or a distracting smile to really appreciate what.
Yeah, because I've been lucky. I really haven't had to have orthodontics or anything like that.
Well, I'll tell you what.
So maybe I'm insensitive to the people that don't like their smiles.
Well, I'm not insulting. I'm not saying anything. But here's the situation. I actually had a problem. I experienced this exact thing, a very distractive smile.
For the sake of time, though, smile makeover. We talked at the top of the show, small improvements could make a big difference. Porcelain veneers. What does that consult sound like? Because my fear would, and we talked about, like big giant teeth.
Right.
So how does somebody know what it's going to look like? How do you put that together?
That's pretty hard to. That's a good question, because I think a lot more people should ask that question. Many times people will come in and they don't even say they trust me, which is wonderful. But I think that might be the reason why we see other people walking around with the big veneers, because they didn't say what are they going to look like. Okay, and so what we do, basically, I want to find out what are you looking for. A lot of times, if they have an old picture of themselves, not too old, but a relatively current picture, they say this is what I want to look like, or they'll bring somebody else's picture in. And sometimes you can, use that as a guide. Obviously, you can't do miracles, but we get pretty close. And so we basically, what we'll do is we'll shape it. We'll put we do what's called a mock-up or a trial.
Okay.
Type of setup. So we put a prototype is really a good
in their
way
mouth.
To put it. In their mouth. We basically.
Interesting.
We don't have to, no numbness, no touching the teeth. We just lay plastic on top of the teeth, and we build it up at how thick it has to be, how long it has to be, and we'll have a mirror. And they say, well, it's a little bit too long. Okay, we trim that back. Oh, it's a little too short. We add to it. So basically, we put the whole thing.
So they're holding a mirror, and they
They're
know what's
looking
going to
at
look
what
like.
it's going to look like.
What do they normally say, by the way, when they see it?
They usually say, wow. And it's funny, because you think there'd be another expression, but it's almost always wow. Okay, they look at it and they say, this is, and I said, is that what you like? And until they say, that's it right there, we keep working on it. And that actually, again, that's a fun part of my day. Some people say, isn't that frustrating? No, this is great. I mean, look what we're doing.
So you do this mock-up.
Yes.
They say, okay, I want this.
Yes.
Then what happens?
Photographs and models. Because photographs is important, but you also have to get the three-dimensional aspect of it. It's a little trickier than just, like I said, slapping stuff on there. Okay. Because you have to talk in terms of what they look like and how thick they are, which is where people get in trouble. Because you need a certain amount of thickness to
people, meaning other dentists.
Yeah. In other words,
well,
the people should ask your other dentist to make sure you do this, because sometimes if you have particularly dark teeth, which you should have gotten them whitened probably, but if you have particularly dark teeth, you need a certain thickness of the porcelain, or else it still looks dark. You have to take that all into consideration. That's something I think probably is missed by most dentists that I run. The problems I see. So basically, we do the mock-up. We take the impression. We have the 3D model. We have the photographs. We have to align the teeth with, believe it or not, the ears. Okay, and the eyes. We have a machine that goes in there and it makes sure that they're not tilted or canted either way.
So the bite, of course, obviously.
The bite's a given. You have to. And most people do that because you can't get away with the bite not working because it won't work.
Okay.
Also, most of the veneer is in the the front of the tooth, and so the back of the tooth where you're biting on a top tooth isn't. you're not hitting it. Now, on the bottom, it's a lot more critical because you actually are biting with the veneer.
Okay.
So you got to be careful about that, and you have to have enough strength there too. So a lot of things you have to do. Veneers are not just plastic things you put on the teeth. They're very precisely made.
How many years have you been doing that?
Veneers?
Yeah.
Actually, the funny part is I did veneers back before they were made out of porcelain. Okay? The science wasn't there. And so what happened is then they started doing much thicker veneers because they needed the strength when they got porcelain, but porcelain you needed more strength. Okay? Not too many years ago, some guys pioneered this very thin way to make a veneer, and it really, it's a very, very fragile piece.
You called it ultra thins.
Ultra thins. Okay, the
Okay.
ultra thins, and when you put it on the tooth itself, you bond it, and it becomes basically takes the strength of the tooth.
Okay.
So as long as I've got it in my hand, it's frightening because I could crack it. Once it goes on the tooth and it's cemented,
Strong.
it's as strong as can
Okay.
be.
So now you send it out to a lab.
Yes.
For the porcelains.
Well, I don't send it out to a lab. I send it out to a particular lab.
Okay.
Because I want to have a lab. I want to have a laboratory that I know is going to do the same thing every time, exactly the way I want it. Okay. There's a lot of there's a couple big companies that have they do a lot of veneers. You've probably seen their commercials on TV. And I want to know the man who is actually doing my veneers. His name's Mark. He lives in Utah.
What, to make it look like a natural tooth?
I want to be able to call him. First of all, I want to know that he knows how to make it look like a natural tooth. But sometimes the patient needs something a little different. And I know Mark well enough. He's an artist. I can't believe how good he is.
Okay.
He's the best I've ever worked with. And this is, I have to go halfway across the country to get it to him, but it's well worth it. Because when I get them back, they are absolutely beautiful. They look exactly like teeth. And if I have a problem, I don't call the laboratory. I'll call Mark.
So when it's all done, they look at their teeth.
When we deliver
Is it
the
ever
final-
Is it ever like emotional for them?
Oh, it's emotional for me. Okay, so imagine what
Really?
it is for them, because I look and I see, I know what's going to happen to this person.
Interesting.
They don't even know yet, but I know what's
So
going
they
to
have
happen.
no idea what the smile is going to do to change their
No,
life.
and that's the thing that you can't really explain. Okay, you can't really explain that because unless it's an emotional thing. When I deliver a veneer or something like that, what happens, or even a bigger case, let's say, I put it in there and we have a big mirror on our wall.
Yeah.
But I hand them a hand mirror, okay, so they can see it up close, okay. But I do also have a big mirror so they can see what it's like when they present just normally, okay. And they look at it, and I'll say to them, I'd never say, how's it look? Because I know it looks great, and they know it looks great.
Okay.
I say, how's that feel? And they kind of, it almost happens every time. They kind of think for a second, and they go like this, and they say, smooth. And I say, yeah, it's really smooth. And I kind of like,
And then what do they say?
then they go, yeah. And half the time I think I'm not trying to say it's not rough. I'm saying it's really neat. It's really cool. It's smooth. And most people get this. They say, yeah, it is. It's not just not rough. I like this.
Is this one of those things, and for the sake of time, is this one of those things that when it's all done, they say, I should have done this years ago?
They do. Okay, and I have a little twist to that because they say, I should have done this 10 years ago. And I'll stop for a second. I'll say, let me ask you a question. How would your life have been different the last 10 years if you had done this 10 years ago? And that gets tears, again, for them and me, because they start thinking about the many times they put up with this and the years. All they had to do it was not a big deal. They were able to do it.
So like 10 years of not smiling. They missed out on 10 years.
of not smiling, which means 10 years of not enjoying a joke as much as the average person does, not enjoying a meal as much as the other person does, not enjoying a conversation as much as the average person does. That's almost criminal. It's a shame, and it's so easy to fix.
So do you think people are judged with poor smiles?
No question about that, okay? And I think the average person would agree. There was somebody actually did a study about this. It was the Academy of Cosmetic Dentistry, which is one of the most respected organizations in dentistry. And they polled, I believe, a group of North American adults, okay? So these weren't dentists, these were just random people. And they asked them a question. They said, have you ever judged the socioeconomic or the educational level of a person solely by their smile.
Interesting.
Okay? 75% of the people admitted that they did. Now, again, I understand it. I mean, I do it. Most people do it. Okay? It's just another thing that we kind of take into consideration. Okay? What I found shocking about that, not about that, but the next question they asked the same people, are you happy about the attractiveness of your smile? Okay? 50% of the people said yes, which tells me the other 50% don't. So I have to ask a couple questions about that. I thought that was interesting. 3 questions. 1, why are they so unhappy with their smile? 2, why are they settling after just finding out that 75% of the people make this decision, this judgment on them based on their smile? So why would they settle for that?
So do something about it.
Number 3, why don't they do anything about it? Absolutely right.
So what do you say? Okay, so somebody watching this, we're out of time, and they're saying, I don't know, fear of cost, fear of pain,
Just make a phone call. Make a phone call to a cosmetic dentist. Find out what your options
call you.
are.
They can meet with you.
Call me. I'd love to talk to you. That's what I like doing the best.
Okay.
Okay? That's the fun part. And we get to people, get into the office, sit down. We'll talk to you about it. We'll tell you your options. You tell me what you want. Tell me, find out where you are, where you want to be. We make a plan, and you can do a lot of it. You can do none of it. If you don't want to do it, fine. I'm okay with that.
Good.
When you're ready to do it, I want you to come back to me.
I want to thank you for coming on the show. This was excellent.
Thank you very much.
Good job.
My
Good
pleasure.
job. And if they want to go to your website, find out more, make an appointment, they get to meet with you face to face.
Yes, sir.
All right.
Glad to see him.
Pleasure. You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, visit our website at wellnesshour.com and just put in Dr. Granados. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.